Depression has been around since the dawn of mankind. Only recently has it become regarded as a treatable illness. Depression affects millions of people all around the world.
We often think of depression as a result of a traumatic event or the reaction to a sad event. But it is actually more complicated than that, and there are many factors at play.
Psychology Pancakes presents the top 9 depression facts. Number 9. Depression comes in 9 common variations.
You might think there's only one form of depression, but there are actually many different types that can be caused by different elements. Clinical depression is the most common type of depression. This type of depression is diagnosed by your doctor. Clinical depression is a medical diagnosis that doctors determine by assessing the specific extent of symptoms present. The severity of an episode can be classified as mild, moderate, or severe.
A recurrent depressive disorder is when you've been diagnosed with depression more than 2 times. Another type of depression is known as reactive depression. This type of depression usually occurs during a traumatic or stressful event. For example, losing a family member or suffering from financial hardship.
Dysthymia is a form of depression that lasts over 2 years. It's different from major depressive disorder, which is intense and only occurs for a short time. The symptoms of dysthymia can be a severe case of chronic depression that brings on feelings of chronic fatigue, low energy, poor sleep, and appetite. It also can cause a decrease in motivation and productivity, which is different from the acute bouts of major depressive disorder. The symptoms are more subtle compared to those experienced by individuals with major depressive disorder.
Manic depression, also known as bipolar disorder, is a type that changes quickly during an individual's mood. Those who are bipolar will be subject to periods of extreme depression.
Psychotic depression, also known as psychosis, is a severe bout of depression that is accompanied by hallucinations or delusions. The cause is unknown, but there is typically a family history of schizophrenia. It can also be brought on by an undetected brain tumor or stroke, but may also occur alone.
Some mothers can experience prenatal depression or postnatal depression after having a baby. Prenatal depression is felt during the pregnancy, and postnatal depression is felt later on and can affect both parents. Postnatal depression is not always a reaction to something specific, such as the birth of a child or divorce. It can be caused by hormonal changes, exhaustion, sleep deprivation, and other factors.
A less common form of depression is seasonal affective disorder, or SAD, and affects approximately 1/2 to 3% of people. Seasonal affective disorder is the result of changing weather and climates around you. It can lead to symptoms such as increased appetite, dysphoric mood, hypersomnia, and weight gain.
Number 8. On average, 10% of all people will experience depression. It can happen to anyone at any age, and is estimated that 1 in 10 people will suffer from depression at some point in their life.
According to a study by the National Survey on Drug Use and Health in 2020, an estimated 21 million adults in the United States had at least one major depressive episode. This equates to 8.4% of all U.S. adults.
A study by the World Health Organization has discovered that approximately 280 million people worldwide are currently living with depression. Globally, it is estimated that 5% of adults suffer from depression, with a higher prevalence in women than men.
Number 7. Sometimes there are no clear reasons for feeling depressed. You may be experiencing a persistently low mood. This can make you feel irritable and less productive. Is this low mood caused by depression? And if so, what could have caused it?
Even if you feel that depression is not the cause, it may have some contributing factors. Some of these factors may be recent, while others might stem from earlier experiences.
It's common to experience intense conflicting emotions as depression sets in, and you may not know why you feel low or sad. It will help if you think about the reasons for your mood.
The reason for how you feel may be a mystery to you, but a trained mental health professional may help you explore this and research possible causes. Researchers have yet to establish a definite cause of depression.
Number 6. There are more than 20 different symptoms of depression. Depression is a mental health condition that can affect anyone. It's a serious illness that causes people to feel persistently sad and lose interest in things they used to enjoy.
There are many ways to recognize when someone is feeling depressed. Not everyone will feel sad, but may experience other symptoms such as a lack of concentration, loss of enjoyment of day-to-day activities, or severe tiredness.
Depression is a mental health condition, and it has a whole range of symptoms. Feeling sad is just one among many. Depression can include one or more of the following symptoms: irritability, anxiety, restlessness, feeling sad or empty.
Some people may experience less motivation or feel like engaging in the things they used to find fun has become more difficult. You can also experience other side effects. For instance, sometimes you will lose your appetite. However, the complete opposite is also true. Sometimes you may begin to comfort eat, which can cause significant weight gain.
Along with changes in appetite, you may also experience disruptions in your sleep habits. Many individuals will develop insomnia or hypersomnia. You may also have thoughts of death or suicide.
Not only can you experience emotional or mental distress, there are physical symptoms as well. These can include headaches, aches and pains in the body, and digestive problems.
Number 5. Treatment is not available to everyone. Many people believe that you can just get over it. However, depression is a real illness that needs real treatment.
In 2014, the World Health Organization established that nearly 50% of the world's population didn't even have access to a psychiatrist. Canada and the United States had approximately 13 psychiatrists per 100,000 people.
And in Europe, the average was around 100,000 people to around 30 psychiatrists. In the worst cases, some countries had over 100,000 patients to one psychiatrist on average.
Number 4. Neurotransmitter imbalance can lead to depression. Neurotransmitters are key in regulating mood and can even vary depending on your emotional state. If not properly balanced, two key neurotransmitters called serotonin and dopamine can lead to depression.
Serotonin helps regulate our mood, promote happiness, and improve our well-being, while dopamine is responsible for regulating emotion and mental processing. Scientists are still trying to determine the cause of this neurotransmitter imbalance.
Number 3. Children also suffer from depression. The Brain and Behavior Foundation has discovered that early-onset depression has been diagnosed to children as young as 3 years old.
A study performed by Dr. Luby at the Department of Psychiatry, Washington University School of Medicine, established that once a child reaches the age of 3, they have attained an adequate level of social development, communication skills, and emotional maturity, making it easier to spot symptoms and provide a diagnosis with acceptable accuracy.
Depression can be difficult to recognize from a young age, as symptoms can be difficult to spot before a child reaches 3 years of age. It is for that reason that no one has been diagnosed with depression under 3 years old. Currently, it is still a mystery whether or not a child is capable of developing depression before this age.
Number 2. The United States has the third highest rate of depression in the world. Across the globe, there are millions of cases of depression. You might think that it's the developing countries that may be suffering the most, as they have more to worry about.
But that's not always the case. A report from the World Health Organization says that the United States is ranked third on the list of top 10 countries with highest rates of depression. India holds spot number 2, and China has the honor of being number 1.
One possible explanation for this may be that mental health systems in these countries are not reaching many citizens. Although there might be systems in place, they're often too expensive and inaccessible for most people.
Number 1. Intelligence has been linked to depression. Ludwig van Beethoven, Isaac Newton, and Abraham Lincoln all had highly developed intellects. But that wasn't the only thing that they shared.
Experts believe they all may have shared similar mental conditions, which supports the theory that people with developed intelligence may be more susceptible to mental conditions, like depression.
When the composer Ludwig van Beethoven died of liver failure in 1827, he had been using alcohol to self-medicate for years. Unfortunately, many things he may have been suffering from could have been managed with today's modern medicine, including a serious case of bipolar disorder. Beethoven's momentary bouts with mania were well known among his close friends, and while he was on a high, he could compose multiple pieces at the same time.
During periods of depression, he spent his time working on some of the masterpieces that are among his most famous works. Sadly, this was also the time he battled with suicidal thoughts. During the first few months of 1813, Beethoven's mental health had deteriorated to such an extent that he would no longer care about his appearance, lose his temper during social events, and stopped composing altogether.
One of the most influential scientists in history, Isaac Newton, also had a lot going on. Historians agree that the genius was hard to diagnose. Newton occasionally went through huge mood swings, which is a significant indicator of bipolar and psychotic tendencies.
It's widely agreed that his lack of connection with people was most likely an indication of autism. It was also common knowledge amongst the people close to him that Newton would write crazy letters filled with insanity and madness, which are known to be symptoms of schizophrenia.
According to one biographer, Abraham Lincoln's friends would write letters referring to him as the most depressed person that they had ever seen. Lincoln led the United States through one of its most trying times, despite his battle with severe depression throughout most of his life. One time he was so overcome with sadness that he collapsed right there on the spot.
Sometimes people are born with conditions that will make it more likely that they'll develop certain illnesses. For example, Abraham Lincoln's mother and members of his father's family all had similar mental conditions or defects, which suggests he was probably biologically more vulnerable to the illness.
If you would like a complete list of all the warning signs and symptoms of depression, be sure to check out our next video.